Can we manage our PCOS with supplements? Can it be cured or can it be managed? Are these supplements even safe? Let's talk about it. Hi, I'm Dr. Kim Sommerville. I'm a general practitioner and clinical nutritionist, and I help women manage their PCOS as well as their blood sugar. So let's talk about PCOS and supplements today. And the first one is going to be inositol. What is inositol? So inositol is a type of carbohydrate or sugar, sometimes better known as vitamin B8, and it can be used to manage PCOS. But why? How can we use this random type of carbohydrate to manage our PCOS? Well, if you want to know a little bit more about PCOS, I have a video here. You can check it out. It lets you know what PCOS is, how to get diagnosed, what are the symptoms, and all of that good stuff. So check that out if you want further information. So the one thing we want to know about PCOS is that it's a genetic disorder. It's a syndrome, which means that it has many different types of symptoms and signs, and they can be different for different women. But the one thing we do know is that a lot of women, about 70 to 80% of women, have what we call insulin resistance. Now, some of us may know insulin as what diabetics need to take, but all of us produce insulin to manage sugars or glucose that come in our body, and we use that for energy. But we find that a lot of women with PCOS tend to not use insulin properly and hence develop what we call insulin resistance. So this supplement called inositol actually helps to sensitize the body by increasing the uptake of glucose into the cells and tissues of our organs that need the glucose to have energy and to do its work. So for example, our ovaries tend to produce cysts or tiny follicles when women with PCOS do not ovulate. So inositol tends to help allow for the glucose to get into the ovaries and produce those eggs that are released and not just sit in them and form cysts. So when it comes to inositol, we have two types that we pay attention to. We have myo-inositol and D-chiro-inositol. When taken into our bodies, studies find that a ratio of 40:1 is the best when it comes to giving our bodies inositol. So that would be about 40 myo-inositol and 1 D-chiro-inositol. When it comes to the dosage, it's found that 2,000 to 4,000 milligrams of a myo-inositol is best to manage certain symptoms of PCOS. So these symptoms include regularizing menstrual cycles, improving egg production when it comes to our ovaries, reducing cravings. There's no specific study that says inositol helps reduce weight. However, it may slightly reduce your body mass index. It also helps to manage your androgens. And sometimes androgens are called male hormones, and that will include testosterone and androstenedione. So if women with PCOS tend to have a higher level of androgens or higher levels of testosterone, they may get some symptoms like increased hair growth, which we call hirsutism, or increased acne or thinning of the hair on their scalp. So it's found that once taking myo-inositol for at least around 3 months or more, these symptoms like irregular periods, cravings, increased hair growth, these tend to be reduced, which is what we want. Now, when it comes to pregnancy, inositol is found to improve pregnancy outcomes due to its improvement of egg production. Once your periods are regularized, that means that we're ovulating more, which gives us an increased chance of falling pregnant, right? However, we find that it is still safe to take inositol during the pregnancy. Remember, if you're going to start any type of supplement, always consult your doctor first. This is not necessarily medical advice, just medical knowledge. So inositol is found not only to improve the likelihood of pregnancy, but it also likely reduces your risk of developing gestational diabetes because of its improvement in the insulin and blood sugar levels. Now, with all supplements and medications, you're going to find that there are some type of side effects, usually minimal at the dosage of 2,000 to 4,000 milligrams, but some persons may notice that they may have an upset stomach, diarrhea, can cause vomiting, abdominal pain, and some persons it can cause dizziness or headaches as well. If you're having any side effects, stop immediately and speak to your doctor or nutritionist. Now, outside of side effects, we find that there can be some interaction between inositol and some medications or some types of supplements as well. It has found that with inositol, you don't necessarily want to be taking it with coffee because of the reduction in effectiveness of the inositol if you do so. You also don't want to necessarily take inositol with high dosages of B complex or vitamin B complex, I should say, because you may find that there is a reduction in the effectiveness of inositol at that time. And there's some literature that also says that you don't want to be taking inositol at the same time as calcium, zinc, and magnesium tablets. These are not hard and fast. There are not many research studies that say this, but I believed it was necessary to bring that point up. If you're taking inositol, usually it should be taken with a meal, so that can be in the morning or at lunchtime, and it also can be taken with dinner. So just ensure that you're probably taking it without these other supplements at the same time, but these other supplements can be taken at different times of the day. I've left some different studies in the comment area for you to look into the studies as well. There have been some types of inconsistencies when it comes to the effectiveness of inositol in studies. Generally, we look at meta-analyses and systematic reviews to ensure that when we're looking at a particular medication or supplement, it is effective for large groups of people instead of just one and two. In 2023, it was found that inositol regularized periods, lowered BMI, reduced cravings, reduced androgens such as testosterone, which improved symptoms of PCOS. But in 2024, another review and meta-analysis showed that it wasn't that effective. Now, for me, when I have given it to my clients in the dosages that are recommended, I have found that a lot of them have regularized their period, reduced their weight, as well as reduced any hirsutism. So it really just depends on the person. If you want to try, definitely do that. The two brands that I recommend is Wholesome Story and Ovasitol. There is another brand that is generally available in Jamaica, and that is the Now brand. So you can definitely give that a try as well. However, I do recommend the Wholesome Story and the Ovasitol brand. The only issue that I find with inositol is that it is not as widely available, especially in the Caribbean countries. So you mainly have to order online, which is not very convenient for most. I would love it to have more research and get to the point of being a type of medication that can be prescribed and available widely, but we're not necessarily there yet. Remember, as far as we know, PCOS cannot be cured, it can only be managed. So when we're considering supplements, it is not that a supplement will cure you, but it will be a great addition to your treatment plan as far as it goes to manage your symptoms and signs of PCOS. Thank you so much for watching. I hope that this gave you some great information today. If you're taking inositol and it has worked or hasn't worked for you, please let me know in the comments. And if there's any other supplement you want me to speak about, let me know that as well. Have a great day.